Hi everybody, so I just wanted to do a little bit of a Q&A. I've been getting a lot of emails and inputs about lots of questions around how to handle certain things, and some of you guys are asking very intelligent and very technical questions. I felt like my answers would help you. So a lot of you complained of a lot of digestive issues such as irritable bowel syndrome. I believe unless you don't have to be diagnosed with irritable bowel syndrome, I sort of diagnosed that for myself because I had a lot of gas and bloating and just a lot of cramping to a point where every time I ate something, I needed to make sure where the bathroom was so I can make a run, and it was 2MI or TMI as they say. It was not ugly. It was just everything just went straight through me. So this whole idea of irritable bowel is because of that leaky gut. You've got to remember we've got microflora in our gut where we have a lot of surface area initially. We've got a lot of hairy surface areas in our gut to protect and to provide what's called a tight junction so that the outside toxins cannot enter our bodies. What happens with lupus is it degrades. Whether it be due to stress or autoimmune conditions over time, things sort of degrade, and now we have a flat surface. There's really no protection for the outside world. You know, we talk a lot about the leaky gut because what do we do every single day? We eat every day. That's something we can control. So I think we focus a lot on the leaky gut because so much happens there, and it's really intimate not only with our central nervous system, but also it's supposed to be our second brain. And if you really understand the biochemistry of how everything sort of works together, it really does have a huge play in our neurotransmitter balance, like dopamine, serotonin, right? Norepinephrine, endorphin rush and such. So it really modulates that and really has a systematic effect in our whole body, not to mention the immune system. So sort of this idea of, I always share, or most of you complain in your symptoms, you have multi-level symptoms. It affects all areas of your body. And so to say, just because you have, for example, kidney stones, that's a kidney issue, and that's the problem with the medical system, right? Because they have to tack on the ICD-9 code on it to make sure we can send you on your way to the nephrologist when the overall picture might be the inflammation. We can say it's the dehydration or whatever, but whenever your body sort of reacts to a stimulus and kind of makes that kidney stones or gallbladder stones or gallstones, for example, the doctors want to first do surgery or give you medications to kind of calm the symptoms down and hope for the best. And if you're not feeling very well, you bet, kidney stones are really painful to kind of pass. And then the gallstones as well. It can be really excruciating. And there's a lot of people that get their gallstones removed. I had a patient recently who called me from the emergency room because she had gallstones. So anyway, all these things said, the better question to ask is, why do you have those stones in the first place? Because if your body is working in its proper order, you wouldn't have any buildup of anything like that. So the pathways for these conversions, biochemical conversions to occur so that our system can run and function normally, is disrupted. And so we accumulate and things kind of sort of back up. It's like I have a septic system in my house because I live out in the country, and whenever it gets backed up, it comes up to our surface area. You don't want to wait until that happens, right? So anyway, I digress. But so the IBS and the lupus, and then the kidney stones and the lupus, the PCOS and the lupus, everything sort of once the system gets imbalanced, you bet we're going to have fibromyalgic symptoms, connective tissue, low back, stenotic changes. All these things happen. So I can't emphasize enough, at the core, we really need to address the overall balance. And how to do that is what I'm trying to share through everything that I put out. So I hope you guys are finding that very helpful. Next thing is interstitial cystitis. Is basically an inflammatory condition where you have very overreactive bladder basically is what that is. And a lot of the doctors will scratch their heads, because I have a lot of OB/GYN friends nearby that send me a lot of patients. I'm a pelvic floor physical therapist down here, where I do work a lot with the pelvic floor and various women, female issues. I see a lot of people with interstitial cystitis, and that's how I would treat it, is through the elimination diet. It's the gut restoration diet. It's the gold standard. It's the cheapest thing you can do for yourself, right? So start there if you have issues there. Do I think it's related? It's not directly related. Nothing is directly related. And what you have to remember is there's a lot of gray areas in medicine. And so whatever they don't know, they like to kind of clump it into the IC, which is interstitial cystitis, and fibromyalgia. And my doctor friends, when we get together and talk about fibromyalgia, we used to roll our eyes and say, okay, there is a mimicry. Like that patient, either A, is a little bit depressive, and so a lot of fibromyalgia patients used to get antidepressive medications, believe it or not. That's how we used to handle them. And that used to be a sort of an emerging word back in the 90s when I was just getting out of grad school. But today it's more than ever, like lupus and fibromyalgia, they go hand in hand, a lot of overlap in the symptoms. So that to say, I see in lupus too, there's a crossover. That's what I want you guys to kind of get the overall message, okay? This is 19 years of somebody who's kind of walked the path, really researched, and I looked at various things, so I've connected the dots a little bit. There's enough research to validate all these things. So one of the other questions that I get is how to know if you're photosensitive. So I used to avoid the sun like the plague when I was first diagnosed, because I had rashes and it was so physical, and it's not very pretty when you have rashes. So I used to think that I needed to avoid the sun. So I would wear, guard myself against the sun, carry an umbrella even on the sunniest days. I grew up in California, so I looked like a basket case. I would have like wide brim hats or not be out in the sun at all. I lived like that probably for about 5 years, and I remember my doctor giving me a referral to kind of shield my glass in my car to filter out the UV lights. And I used to go to great lengths to do that. What I find now, that everything is sort of balanced. Once you find your body to be balanced again, you can sort of kind of toy with being out in the sun. So what I do is not at the most hottest times of the day. So I avoid the sun probably from 12 to 3. Outside of that, I do bake in the sun maybe from 5 to 6 sometimes, just to make sure I do have some vitamin D synthesis. And by the way, on that note, most of you who have lupus, you guys are deficient. And I will tell you, conventional medical levels that they tell you that you're normal, I don't take lower limits of normal. I want you at higher limits of normal. If you have questions about that, please text message me or put another feed so that I can address that. So that's the photosensitive part. A lot of people are photosensitive, but in my experience personally, I believe that it was a lot, in large part, due to some of the medications that I was taking as well at the time. Prednisone, certainly, you shouldn't be out in the sun. And everything makes you very hypersensitive, and it's an autoimmune condition. So once you kind of get it kind of to a level where you can balance, I feel like I'm at that stage where I kind of know how to kind of roll with the punches and make sure I don't flare up. Then you can kind of toy around to see what the results are. And I guarantee you there will be a day where you can go out in the sun. I truly believe that you can heal enough so that you can enjoy the beach again. Last question I'll answer is prednisone. How long should you be on it? Well, I was on it for 3 different times. I was on it steadily initially. And so I've been exposed to it for quite a long time. As a result, I have osteopenia, kind of getting severe, at high risk for osteoporosis. So that's why I do the things that I do to build up my core so that I can be decompressing myself every day. I really, really do pay attention to everything that I do, or everything, all the muscles that I activate. So to go back to that prednisone question, your doctor will fight with you, but sometimes I think they don't look at the size of the patient sometimes. I've been exposed to a lot more higher dosages of plaquenil as well as prednisone. prednisone and then even the Cellcept, I've always had to say, like, I'm a little petite individual, I don't need that much. So I always fought to titrate my prednisone down. I will say your body does make cortisone in your body. So my rheumatologist and I had a very big debate. She's a great friend of mine. She said that 7.5 milligrams is physiologic, meaning that's about how much your adrenals produce cortisone in your body. But once you've been on prednisone, your adrenals are fatigued, like they're gone. So they're not producing that anymore, and that's why it's so important for you to titrate carefully down. So you don't want to tamper with prednisone without medical supervision. Talk to your rheumatologist, and if she doesn't want to titrate you down, she's probably afraid you're going to go into a flare because it's not her fault. That's all they know to control your flares. And so you have to be kind of wise and kind of go into the gray areas, and that's sort of the reason why I call myself a rebel, because I've always fought to kind of decrease my toxic meds with all my might and fire my doctors, and they have a funny joke about it with me whenever I don't need them. So, but after the third flare, I don't fire them anymore. We're in constant communication. I love my rheumatologist. So listen to your rheumatologist and see if you can talk to her and have an open communication about what their thoughts are, and then what your thoughts are, what your aim is, and get those levels. I was very heavily involved with my labs. And every 3 months, you know how you go in for lab checks. I would know what my white blood cell counts were, you know, all my lupus panel counts, ANA, like I would follow it to the T. And make sure I told her, if my complement levels are here and my ANA reaches here, then will you then go ahead and, you know, work with me to get the prednisone down. And so now I've been off of prednisone. It's the last thing I'll ever take, and hopefully I can keep it this way. So I hope this all helps. You know, I think this is a good way for you guys to kind of hear what I have to say. Oftentimes in the blog setting or in the Facebook feeds, I get lost. You guys, there's so many interactions happening in there. I never thought it would get this busy and so hectic. So those of you who are getting buried in so many feeds, I apologize, but it's sort of a good thing. So please feel free to chime in, ask away at the questions. I try to do my best to scan all the things in my feeds. And I think Facebook has an algorithm where they kind of organize whatever I see is different from what you guys put out. So be patient, and I'll talk to you soon.